Hi all, it's me Dr. Amrita here. Hope each and everyone is doing well and good. And today my video topic is entirely different. I'm dedicating this video for all those who just passed this neat UG entrance with flying colors and who are join their first year MBBS so soon. So which book is so good and how to go about it. So why am I putting this video? Because during my time actually speaking, nobody was there to guide me to say this book is good, not this, like that. So I thought, I hope this video may benefit you guys. And it's me, Dr. Amrita. If you're new to my channel, I again say, if you love to watch my videos, please do subscribe, guys. So first of all, first year, you are having three subjects, that is anatomy, physio, biochemistry. And just before going to say about the subject, I want to say that you're all in a phase like you're maybe someone will be repeating more than one time, like 1, 2, 3, and you are just working so hard to get your dream branch and dream seat, that is an MBBS seat. So finally, you're getting your seat. So, studying entrance and studying first year MBBS is entirely different, and there is no competition. Because you're new to a place, always be polite. Don't put anything, don't provoke anyone. That is what I want to say. That be polite, because when you're a new area, everything will be new for you and all. So in our college, I want to say about, I have studied in Amrita Institute of Medical Sciences, Cochin. It is a fabulous college. If you guys ask me which one do you love, whether my home or Amrita, I will say that it is Amrita and my home, because I really love Amrita. Because if I start speaking about Amrita, I want to do a video, I think more than 5 videos, because there are so many things to say. So in our college, actually speaking, there is no ragging. There is no ragging. All our seniors are like very helpful, and also there is no ragging. Okay, so what I really want to say that you were in a coaching institute that will be very competitive, like 1 mark, 2 mark, like this. You'll be very competitive. How your friends are like this and that. It's not like that. And once you join in a first year MBBS. So first year MBBS, what you need means you should be very polite, and you should need to cultivate cultivate a habit of sharing. It's not I'm sharing that sharing clothes or anything, not that I'm saying. You want to like a feel of sharing. It's like there may be lot many like homeworks or something, records and dissection hall. There may be so many like you want to draw the pictures, so many things, like if somebody else doesn't know, someone cannot understand something, some topics around, you want to cultivate a habit of helping them. So sharing and helping, that is a most important thing that you need to cultivate. Nobody is going to say. And always be polite with your seniors. Okay, don't try to be so super smart or anything, because you're new to that college. You don't know, you are just entering. So don't try to provoke anybody. Okay. So next, you want to understand there are three subjects. One is anatomy, biochemistry, and physiology. So what I want to say is anatomy is going to be, you want to study so many things. And for me, anatomy was the very little bit, not little bit, it's a hard subject for me, I want to say. I was not that good in anatomy, because what happens once I study anatomy, it's just like burning a camphor. Everything becomes just vapor. So this is the nature of anatomy. So how to study this anatomy? If you're planning to study any subjects, just try to relate, or just try to understand and learn. That is the most important thing. Otherwise, just before 2 days before the exam, you feel like, oh my god, I didn't remember anything. This is what going to happen once you join MBBS. This every time when you write exam, you feel this. So to avoid this, always try to correlate something and learn. Easy mnemonics and all. That's going to literally helps. And how to study is like anatomy. There are two books like Chaurasia, Kulkarni, Gray's Anatomy and all. So what I really want to say that for UG students, it is good to go with Chaurasya. Chaurasya is more than enough. There is a good story and there's a very interesting story in this Chaurasya. Actually, this Chaurasya, he was unmarried, and till now this patency of that book is what's his servant. He was a very very good person. Like he asked to go all this patents is going to his servant. So Chaurasia was actually a very good man. So yes, if I go behind the story, it will go like this. I really want to concise this video. So first of all, there will be Chaurasia as well as Kulkarni. It's better to go with Chaurasia. Kulkarni I have read, but I don't feel that much good. Chaurasia is Kulkarni, yes, Kulkarni is okay, but Chauras is more good. For UG, Chauras is always good. And also there is a book called as like Gray's Anatomy. So there is Father Gray's, Small Gray's, that's all. That is Student's Gray's. So always go with the Student's Gray's is more good. Because in this your levels, first you are starting. So always go with small chota B. Like that, Student's Grace is always good, because in Student's Grace you can see so many pictures, the live pictures. When you can just Google and see that there is a very good colorful book. You can see all those nerves and all those things. So very very clear cut picture. And it cost around like 2,500, 3,000, I think 3,000 range. I had one Student's Grace, but if you guys ask me, I cannot show all the books because I have got some dust allergy, and if I start taking all those books, I start sneezing. So because of that, I will put the screenshot of all this thing here, so you can see that. So Student's Grace is a very good book. And yes, in anatomy, when you're studying anatomy, first of all, in dissection hall, in our time, there is a book called as Cunningham. That is for practical purpose. In Amrita and all, our professors used to say that you don't want to carry any other books like Chaurasya, nothing. When like during the beginning of the first year. So when first at the end of the first year, everything got changed. We used to carry Chaurasya and all. But during the few days, the first few days, they used to say that don't bring any of the book. The highlighted book was Cunningham. So because during that dissection hall, everyone used to open this Cunningham book, and two of them used to read that Cunningham, and the other people used to do the dissection. If I speak about my college days, for one cadaver, like one cadaver is actually for 14 people. Like 14 students, one cadaver. So we will get like rotation basis 1, 2, 3, and every day, two people used to do the dissection. And I heard like so many other colleges, some of my friends are studying at that time. One cadaver is for 25 people. I don't know how they like manage. So it's actually difficult for us. Like we have enough cadaver, and we have like for one cadaver only like 13 to 14 students, so they can actually study very well. And also, if I speak about my professors, they're so fantabulous. I'm so happy to be an Amritian, and everyone is very excellent doctors. And in our days, actually, I want to say that this anatomy was a terror, because every day they will be going to ask you questions. So what we used to do this, behind of this Cunningham, there is like a box like of regarding this origin and insertions of like muscles. So we used to learn that thing. So that is good. So in back of the Cunningham, just look, there is some insertion and all those, and just study all those things. So when you're studying this anatomy, it's not only Chaurasya and not only Cunningham. There are so many books, because so many branches are there. Histology. Histology means you just look through the microscope. That's as simple as what I want to say. At first, some of my friends, what they used to do is they will be picking up all the slides lightly broken. And this maybe that cerebellum is not going to work out actually. During exam time, they are put all the new slides. So it's not going to work out. So you want to understand and learn. Okay. So yeah, histology, there are so many books. So there is some book like Edinburgh book is there, and that most of them will be following that book. That is okay. It's a pretty good book. And also I read other book is along with Edinburgh. I have read Gunashekhar book. See, Gunashekhar book actually just like an atlas the pictures. You can just see the pictures, that's all. So this Edinburgh book is more good because there is like theory knowledge is much more there in this Edinburgh books. Actually speaking, I forgot the names of the books. Actually, I just gone and just search all those names because yes, that's happens sometimes. And for embryology, you will be having another book again, this Edinburgh book. So just let me check that. Yeah, let me check my tab. 1 minute, guys, because I used to forget all those books names. I'll show you actually. Yeah, I will show you. Yeah, this is I don't know whether you can see. This is a book actually. What is this? Interber Singh's. Yeah, Interber Singh's books. That is test book of human histology. It's a very good book. It's okay. It's pretty. You can understand that. It's good actually. And the other book, that is this thing, test book of histology practical guide. This is by this JP Gunashekhar. That is a good, just to see the pictures, it's really good. I used to have this both the books. And okay, and also there'll be surface anatomy. There's separate things, that surface anatomy, that is if they will ask from where, like in clavicle from this to this, what is the distance. So in just like that, surface anatomy, you want to, yeah, once you get into it, you will understand surface marking. For that, the book, yes, this is a book. This is good. I don't know whether you can see it. A Halling one book. This is what I learned for the surface anatomy. And this book is actually good. Here you can study the surface anatomy as well as the radiology. So it's a very good book. And for, yes, human embryology, the other good book is again this Interbursing. This book is really good. And we have one handbook of anatomy. That's again this Chaurasia. There's a general anatomy. For us, for 2 marks from this book actually, there will be a question. Yeah, from that entire book, a small Chota Beam book, 2 marks question will be going to ask. So we used to just read it and go. And I really want to say that, sorry, I just forgot. For bonds and all also, I had a book, actually speaking, I forgot the name. If you guys want me, I will just search. There is a separate book for bonds. I don't remember actually. Yes. What's the name of the book? I just forgot. Sorry, guys. If you want, I will just search and I will put those things. Yes, yeah. How to pass this anatomy? What I feel that it's really, I'm speaking from my heart, a bit hard for me. It was hard for me actually. I used to spend most of my time like behind this anatomy. What it's depend for people to people. For some of them, for me actually, biochemistry, I love biochemistry. I love biochemistry because biochemistry was very easy for me. And for so many people, they doesn't like biochemistry. They love anatomy. It's depend upon the taste, your taste. So yeah, and yeah, how we pass this means there'll be questions like for small marks, just like 4 marks, 6 marks, half of anyway, like 50% of thing, 50-50 you take. Like if you study histo, if you study embryo, you will get 50% marks. That means these are chota things. So we will use to study this chota things, like one histo we will study and embryo we will study. So we will get again almost 15% of question. We will be getting correct. So like that way we will be going, like embryo, histo and all those things. And yeah, you want to study this anatomy. Before that, I want to say that you want to purchase our bond set. And what we used to do is like somebody has gifted me a bond set. So it was a very beautiful, like white, very beautiful skulls and all that. And after soon I passed out, I gifted another one. So what my seniors, sorry, not seniors, my colleagues used to do is, during at my time, it's cost around like 10 or 11 or 12K for this bond set. I think 13K. I don't exactly remember. It was a bit expensive. So what they do means, once they pass out, they used to sell this bond set. If for 12K, they will send for 13K. It was just like that. Okay. and you want bond set. So bond set means when you get that skull and all, you can put some wires, some coloring and all you can learn. Like there are so many mnemonics you can study in that way. And histology, yeah, when I speak about histology in Amrita, actually every time they used to ask questions for us, every day. So we have ma'am called Asha madam, Reddy madam. Actually, they are super. Our HOD was mini ma'am. She is amazing. They used to ask questions. So, I used to have tachycardia. I don't express it outside, but I used to have tachycardia. We all have tachycardia actually. They used to ask questions. We want to, like, every day there'll be one topic. So we want to by heart everything, and they'll be gonna ask you so many vivas and all. If you didn't say, we'll be out. So yeah, it was actually yeah. First you feel like it is like terror, but after that, once you get into it, it is really really interesting. They used to help us, like always. You have got two pencils, one pink one as well as a violet one, eosin and hematoxylin pencil, and yeah, yes, we have to draw the records and all. Yes, and also in we used to have like fill in the blanks, and every months we will be having like entrance based so many tests always. And in our dissection hall, as I just already mentioned, like every time they used to ask questions, every day questions will be asked. And what I'm so happy again to be in Amrita, because they provide us mask and everything. So in most, some of them get formalin irritation, then may get allergies and all. So for us, they will produce like give mask and all, mask, gloves and everything. So what my professor do means, during the viva, every time there will be viva for us in the section table, and they used to ask questions. So we used to hide behind the mask, but they ask us to pull it down. So yeah, and it was really interesting actually. Yes, anatomy, these all things. So like head and neck, upper limb, lower limb. There are so many things. So yeah, this Chaurasya is actually good. It's an okay book. And also I want to say that the important thing, just draw pictures. What we used to do is we used to draw, it's not that hi-fi beautiful 3D pictures. They're not looking, just they need to see your markings. That is what important. We used to draw some pictures, and we used to have color pencil. In Amrita, sketch pencil is, sketches is not, we don't, it's banned. We cannot use sketch means this paper, this backside, and this gonna be a problem. So they ask us to, if you want, you can use this color pencils. So we used to draw pictures, diagrams, and we used to color. So once they see this diagram, sir, they will look down whatever, but this color, this diagram is going to attract them. If you, this diagrams and everything, you will get a good mark. So always remember, MBBS, your papers should be filled with color pencils. So many diagram, how much diagram you can draw, just draw. And that is going to be like when you like, instead of writing so many essays, put some diagrams. That is going to fetch you so much marks. And about, yes, anatomy, yeah, we also had some simulation centers. Actually, Dr. Gopal sir have done this. Gopal Krishna sir, actually he passed away. That is a very, yeah, because he was very amazing, because his classes we have, it's so like he put some comedies in Beethoven. And also he have a very big simulation center. Like simulation center means there will be so many like creative things that he actually made. So you can see all those like specimens, like everything. Just if it is in a year, he will make that. So just like all, you can see the auditory pathway and everything. He have a solution, like for, he makes anatomy actually simple. We lost him, sir passed away before 2 years, I think. So it's a major miss for us. It's very sir, it's an amazing sir actually. We always remember him. And yeah, this is all about anatomy. Yeah, okay, this is all about anatomy. And